Egg freezing, also known as oocyte cryopreservation, is a key component of the IVF process. In a world where life takes us on many adventures, fertility preservation through egg freezing offers a unique opportunity to press pause on your biological clock. Learn about the empowering choice of safeguarding your future family while pursuing your dreams and aspirations today. Watch the video till end and subscribe to our YouTube channel. Here is how eggs are frozen using IVF. Ovarian stimulation. The process begins with ovarian stimulation, similar to a standard IVF cycle. Fertility medications are prescribed to stimulate the ovaries to produce multiple eggs instead of the single egg typically released during a natural menstrual cycle. Monitoring. During the stimulation phase, the woman's progress is closely monitored through blood tests and ultrasounds to track the development of ovarian follicles, fluid-filled sacs containing eggs. The goal is to retrieve several mature eggs. Egg retrieval. Once the follicles have matured, an egg retrieval procedure is scheduled. This is typically done under mild anesthesia or sedation to minimize discomfort. A thin needle is inserted through the vaginal wall to access the ovaries, and the eggs are aspirated from the follicles. Egg assessment. After retrieval, the eggs are immediately examined by an embryologist to assess their quality and maturity. Only mature and viable eggs are suitable for freezing. Cryopreservation. The selected eggs are then cryopreserved, which involves a process called vitrification. Vitrification is a rapid freezing technique that prevents the formation of ice crystals within the egg, which could damage it. The eggs are exposed to a series of cryoprotectant solutions and then quickly plunged into liquid nitrogen for ultra-rapid freezing. Storage. Once vitrified, the frozen eggs are stored in liquid nitrogen at extremely low temperatures, typically around -196 degrees Celsius. Eggs can remain in storage for several years without significant deterioration in quality. Thawing and fertilization. When the individual is ready to use the frozen eggs, they are thawed using a controlled process. After thawing, the eggs are fertilized through IVF with sperm, typically from a partner or a donor, to create embryos. Embryo transfer. Once embryos have developed and are deemed healthy, one or more embryos are selected for transfer into the woman's uterus during an IVF cycle. This embryo transfer is performed at an optimal time in the menstrual cycle to maximize the chances of successful implantation and pregnancy. Egg freezing is an effective method for preserving fertility, especially for individuals who are about to undergo cancer treatment, have medical conditions affecting fertility, or simply wish to delay family planning. It provides the flexibility to pursue pregnancy at a later time while preserving the quality of the eggs at the age they were frozen.